There, welcome back to English for Specific Purposes at the B2 level. We are your hosts. I'm Mr. Daryl.
And I'm Miss Tatia. მოგესალმებით. კეთილი იყოს თქვენი დაბრუნება ჩვენს ტელესკოლაში. მე თათია ვარ, ეს კი ტერილია. დღევანდელი გაკვეთილის თემა კი კვლავ პაციენტის მოლა. But before we move on to the lesson, I think that we have to look at our agenda. What do we have on our agenda, Mr. Daryl?
As we usually do, we have an introduction where we talk about the topic a little bit, move from there to a vocabulary list, which will prove to be useful later on when we do our reading text for today. After that, we look at grammar, as always, and then we wrap things up by giving you homework.
გაკვეთილს როგორც ყოველთვის დავიწყებთ თემასთან დაკავშირებული შესავლით, შემდეგ შევისწავლით ასევე ამ თემასთან დაკავშირებულ ახალ სიტყვებს, შემდეგ წავიკითხავთ ტექსტს, ამას მოყვება გრამატიკა, საბოლოოდ შევაჯამოთ გაკვეთილს და დავასრულებთ საშინაო დავალებით. Let's get started. So the topic is nursing.
Nursing, again, a very important job in modern society. Ms. Tatia, what do nurses do? What are their duties?
First of all, nurses have direct contact with their patients. They take care of them. They usually take blood tests, give injections, take blood pressure. So I think that they are very important. Okay, sometimes they have more contact with patients than the doctors. Okay,
so I think that stressful as well.
It's a stressful job, really. They have to take care of everything, be very attentive to their patients.
And they have direct contact with the patient, and there might be perhaps conflict as well there.
Yeah, sometimes. So I think that nurse's job is really, really hard, and you have to think a lot before you become a nurse. And once you become a nurse, I think that you have to be dedicated to your job, right?
Okay. Very well.
Now let's move on, and as we have promised, we have to teach some new words. And let's look at the first word we have. The first word we have is seizure. Seizure is a noun, and in Georgian it's translated as sheeძლებათ. Seizure. How would you define that word, Mr. Daryl?
A seizure is a kind of like a interruption of the body and the mind, or the physical body as well, a kind of convulsion where the body stops working the way it should be.
Okay. Definitely not a very good thing, right?
No, the worst thing.
Okay. Seizure, it's a noun, and in Georgian it's translated as sheeძლებათ. And an example here, we found out he was epileptic when he had his first seizure. So usually epileptic people have seizures, right, from time to time.
I had no idea about epilepsy until I saw a friend of mine. He suddenly had a seizure in front of me,
really?
And we didn't know what to do, but then we had to lay him down, and it was very complicated.
And I think that everybody should know this first aid.
Yeah, it's important because I was in that situation, and you might want to educate yourself on what to do.
Okay. So, and what is the next word, Mr. Daryl?
Ache. It's simply pronounced ache.
Ache, and it's used in headache, for example. So ache is a noun, and in Georgian it's translated as tkivili. And we have different types of aches, for example, headache, backache, stomachache, toothache, right? So ache is the same as pain.
A consistent pain. It can be low frequency, or it can be sort of higher, and it's just a pain.
Okay. Ache, it's a noun, and in Georgian it is tkivili. And an example here, as you get older, you have all sorts of aches and pains. And the next word we have is sprain. Sprain is a noun, and in Georgian it's translated as დაჭიმულობა. Sprain. So sportsmen usually have the sprain, right?
Footballers and so on. Yeah, it's an injured joint, part of the leg or arm or something.
Okay. Sprain, it's a noun, and in Georgian it's translated as დაჭიმულობა. And an example here, at the gym I had an ankle sprain. So, and what is the next word, Mr.
Bruise. It's a noun, and it's bruise.
Bruise is a noun, as Mr. Daryl has told us, and in Georgian it's translated as silurģe. Bruise. And how did you find that word, Mr. Daryl?
Well, I'd say this, it's an injury, or even just mark on the body, where the skin hasn't broken, but you have been wounded, you have been hurt, you've been maybe perhaps forcibly hurt by something.
And it's usually blue color, right?
Blue or purple, yeah.
Blue or purple. So bruise it's a noun, and in Georgian it's translated as silurce. She had a few cuts and bruises, but nothing serious. So maybe it was after the accident, right?
Yeah, after an accident.
And the next word we have is scar. A scar is a noun, and in Georgian it's translated as naiarevi. Scar. And how would you define that in English, Mr. Darrell?
It's a mark that's left on the body after an injury has healed. So it's a scar that hasn't vanished away, and you can see the remains of it.
Okay. Scar, a noun, and in Georgian it's translated as naiarevi. And an example demonstrates how we use the word. That burn will leave a bad scar.
I think everyone has got some kind of scar somewhere.
I don't.
You don't?
No.
Well, lucky.
I have been very careful in my life.
You've never gone skiing?
No.
You've never gone skiing or bike riding down a mountain or something?
Yeah, but just I'm a very careful person, so I don't have any scars. Okay, and I think that we have finished with the words, and it's time to practice the words. So we will see the sentences on the screen, and we have to choose the right word for the gaps.
And I think you'd like to go first, wouldn't you?
Of course, I'm ready.
Let's go with this sentence now. A something usually takes longer to heal than a broken bone.
Yes, I remember my son had a sprain. And it took a month to heal, so I think that there should be a sprain. So, and I would say the sentence like this: a sprain usually takes longer to heal than a broken bone.
And you are right.
Okay.
Well done.
Now the next sentence for you, Mr. Darrell. I've got a, then there is a gap, where I hit my leg against the corner of the table. So if you hit your leg against the corner of the table, you generally have what?
A bruise. You don't really hit it hard enough to cut your leg. You just kind of bump it. So I would say this: I've got a bruise where I hit my leg against the corner of the table.
You are right, Mr. Darrell. And it's my turn now.
It's your turn. The wound healed without leaving a something.
Okay, and I think here should be a scar. The wound healed without leaving a scar.
Well done, that is exactly correct.
And the next sentence for you, Mr. Darrell. I've had a stomach, then there's a gap, all morning. And we've talked about it,
yes,
right?
we have. I hate when I have this, but it's stomach ache.
Okay, and you are right, and the sentence sounds the following way. I've had a stomach ache all morning.
And the last sentence, of course, further assessment was interrupted when the patient had a
seizure, of course. Okay, and the sentence sounds like this: further assessment was interrupted when the patient had a seizure.
Of course, the seizure is very serious, so it would have stopped whatever was going on.
All right. So, and I think that we have finished with the first set of vocabulary. It's time to move on to reading section, and our reading is about pain and pain assessment and nurses' job to assess pain, which is not very easy, by the way. But before we move on to the text itself and the reading itself, I would like to ask you, do you often take painkillers?
No, actually, I don't like to take pills of that kind at all. I'd rather let pain kind of go by itself. I might sleep on it. I might.
The same here. I avoid taking any painkillers. I'd better just to sleep or just think about something else and just get rid of this pain like this.
You don't trust the pills?
I don't know why, but just I really don't like taking any painkillers. I don't know the reason.
A natural way of getting rid of it.
Yeah, I might drink tea or coffee or something like this, and just it will go off.
Very good.
And one more question: have you ever experienced a severe pain?
Not that I can think of. It's difficult now to think of a severe pain that I've had. Have you?
No, never, by the way. I think that we are fortunate.
Well, you have no scars, you have no severe pain.
Yes, because I take care of my health and myself. Okay. Now let's start. I think that we have to learn the words before we read the text to make it easier for us to understand the text. So the first word we have here is crampy. Crampy is an adjective, and in Georgian it's translated as qrunchkhviti. It's usually connected with pain, crampy pain, right?
Yeah.
Okay, so how would you define that word, Mr. Daryl?
It's a sudden painful tightening, so getting something tighter in your muscle or in the body.
Okay, so crampy, it's an adjective, and in Georgian it's translated as qrunchkhviti. And we have an example here. I've got crampy pain in my stomach. And what is the next word we have, Mr.
The next word
Daryl?
is excruciating. Excruciating.
Excruciating is an adjective, and it's translated as tslieri autaneli. And again, it's used with pain, right? For example, excruciating pain is severe pain.
Severe, like the most extreme pain you can imagine.
Okay, so excruciating, it's an adjective, and in Georgian it's translated as tslieri autaneli. And an example here, he had an excruciating pain in the lower back. Okay, now let's move on, and the next word we have is swelling. Swelling is a noun, and in Georgian it's translated as gasieba. Swelling. How would you define that word, Mr. Daryl?
Well, it happens when a part of your body gets bigger or more increased in size because of a pain or because of an injury.
Swelling is a noun, as I said, and in Georgian it's translated as gasieba. And a very good example here, put your foot into cold water to help the swelling go down. It's a good recommendation, right?
Yeah, it works.
And what is the next word, Mr. Daryl?
Anxiety. Anxiety.
Anxiety is a noun, and in Georgian it's translated as shpotva. When you feel unrest or
you feel uncomfortable, you feel worried, you feel nervous about something that might be happening to you or that you expect to happen in the future.
Okay, so anxiety, it's a noun, and in Georgian it's translated as shpotva. And an example here, he has helped patients suffering from anxiety, depression, and eating disorders. So they are somehow connected with each other, anxiety, eating disorder, and depression, right?
Whenever you don't feel too well, you start to get anxious, and you get anxiety, and start to worry.
And the next word we have is
inflammation. Inflammation, it's a noun.
Inflammation is a noun, and in Georgian it's translated as anteba. Inflammation. Is it a kind of an infection?
It might be, it could be. It's a red, but specifically it's a red kind of swelling or kind of a mark on the body.
Okay. Inflammation, it's a noun, and in Georgian it's translated as anteba. And we have an example here, aspirin reduces pain and inflammation.
It's very useful.
And the next word we have is
liver.
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 Liver is a noun, and in Georgian it's translated as khvidli, a very important organ, right?
Yes, it's a very important organ. Its purpose is to clean the blood, and it also produces bile, which is part of the entire body system.
Liver, it's a noun, and in Georgian it's translated as khvidli. And an example here, symptoms of the disease include an enlarged spleen or liver. So I think that's what doctors usually look at, right? Whether our liver is of the normal size or not, right?
And they do blood tests to figure out how the liver is working.
Yeah. And I think that we have finished with words, and it's time to move on to reading text, which is about pain assessment and how we should assess pain. Pain assessment. Assessing pain can be complicated as the physical and psychological aspects of the patient all need to be considered. Because the experience of pain is very subjective, the nurse needs to be able to use some objective criteria to evaluate the location, nature, and intensity of the pain, so a diagnosis can be made. One of the most widely accepted definitions of pain was put forward by McCaffery, who suggests that pain is whatever the experiencing person says it is and exists whenever he says it does. Assessments of the patient's pain experience. When identifying the characteristics of the patient's pain, it's essential the nurse considers the following. Now let's see what the nurse should consider.
Be good news for all of us to learn about what these types are. Now, the type of pain. Is it crampy, stabbing, sharp? The patient's description of the pain might help in diagnosing its cause. Myocardial or heart pain is often described as stabbing, but liver pain as cramping or aching. Its intensity. Is it mild, severe, or excruciating? This can be described by using a pain assessment scale. The nurse asks the patients to rate the pain on a scale of 0 to 10, 0 being no pain and 10 being excruciating pain. With children, a range of pictures showing a child changing from happy to sad can be used. Color charts with a series of colors from black through gray to yellow and orange can be used, especially with patients who have difficulty grasping numbers or articulating exactly what their pain is like.
Okay, so there are different ways of assessing pain, right? And we have to pay attention to a lot of things, right?
And they change it for kids as well.
Yes, because kids cannot express their feelings so easily. And the next thing is the onset. Was it sudden or gradual? Find out when it started and in what circumstances. What makes it worse? What makes it better? What was the patient doing immediately before it happened? Also, its duration. Is it persistent, consistent, or intermittent? Its location. Ask the patient to be as specific as possible, for example, indicating the site by pointing. Changes in the site. There may be tenderness, swelling, discoloration, firmness, or rigidity. With appendicitis, a classic sign is the movement of pain to the right and downwards. In a myocardial infarction, a heart attack, pain classically radiates down the arm. And when liver pain, it can radiate to the shoulder. Good tips.
Lots of tips. Any associated symptoms. One of the common symptoms of disease that can influence the response to pain are anorexia, constipation, cough, inflammation, anxiety, and fear. Also dryness of the mouth. Signs such as redness, swelling, or heat as well are all of the characteristics of pain.
Okay, it was very interesting text and very useful, I think. And if we take everything into consideration, we can just assess the pain somebody around us has and help somehow.
Do you think you could be a nurse after all that information?
No, of course not. But just in some kind of extreme situation, I might just be able to help
someone.
Okay, now let's check how well we remember or we have understood the text. There are statements and we have to decide if the statements are false or true. And the first statement is the following. Assessing pain is a straightforward process. Is it a straightforward process?
No, I think in the text nothing's really straightforward, so I think it must be false.
Yes, you're right, Mr. Darrell, because we read, assessing pain can be complicated as the physical and psychological aspects of the patient all need to be considered.
Very good. Now, here's your sentence.
Yeah, I'm ready.
It is important for a nurse to use objective criteria to measure the level of pain.
And it's true, I remember. We read, because the experience of pain is very subjective, the nurse needs to be able to use some objective criteria to evaluate the location, nature, and intensity of the pain, so a diagnosis can be made.
Excellent, and you are right.
Nice. And this is the sentence for you. Color mood charts are only used for children. What do you think? Is it true or false, Mr. Darrell?
Feel like I want to say yes, but I think perhaps it can be used for other purposes as well, so I'm going to say false.
Yes, you're right, Mr. Darrell, because we read color charts with a series of colors from black through gray to yellow and orange can be used, especially with patients who have difficulty grasping numbers or articulating exactly what their pain is like.
So not just children.
Not just children.
And here's your sentence. The first step for a nurse is to identify characteristics of the patient's pain.
And I remember that it's true because the first thing on the list of recommendations was this, okay? We read, when identifying the characteristics of the patient's pain, it's essential the nurse considers the following. And the first thing was the type of pain, so
Okay.
it's true. And I think that we have finished with the reading and it's time for grammar. And the grammar topic today is cleft sentences.
Oh, very useful.
Yes, we use cleft sentences when we want to emphasize something and put this information, what we want to emphasize at the beginning.
Beginning of a sentence.
Let's look how it works.
You can use cleft sentences in conversation to highlight the information you want someone to focus on. Structurally, you move it to the beginning of the sentence, particularly what's the most important thing.
Okay, and the form is the following. We start with it, plus verb to be, then important information, then the remainder of the sentence, and this is the cleft sentence, and here's an example. It's stress that makes you hear the phantom ring. So I wanted it to put it first.
Stress,
yes.
right? Yeah.
And the next sentence is, it was the nurse who rescued me. So I wanted to emphasize that it was the nurse who did this.
And not someone else.
Not someone else, okay. And the next one, it's Tuesday, we have an appointment with the doctor, not Wednesday. So I have to highlight the day of the week which we have, when we have this appointment, okay?
Sometimes I use this form to make sure that the person listening to me gets the day correct.
Yeah, by the way, it helps listeners to just
you're helping them by using this format.
Okay, and here we have the sentences, and we have to transform them into cleft sentences. Here is the first one. Hearing the noise was distracting the doctor. So highlight what was the thing that was distracting the doctor. How would you say it?
So I'd want to highlight that it was the noise, and I would say it in the following way. It was the noise that distracted the doctor.
Okay, now I just understand that you want to highlight that because of that noise, the doctor was distracted. Okay, now it's for me.
Yes, here's your sentence. The young surgeon assessed the condition of a patient.
Okay, I want to highlight that it was the young surgeon who just assess the condition of the patient. So I would say the sentence the following way. It was the young surgeon who assessed the condition of a patient. Maybe
you wanted to emphasize that he was a young surgeon, and it's surprising, maybe he's a talented surgeon.
Yeah. So the next sentence for you, Mr. Darrell. The nurse tried to calm the patient down. So it was the nurse who did it. So how would you say it?
And if I really wanted to convey that to the person, I would say, it was the nurse who tried to calm the patient down.
Okay. And the next one for me.
Here you go. The operation is due on Monday.
Okay, I want to highlight that this is Monday. And I would say the sentence the following way. It's Monday that the operation is due. So I want you to remember it and not to forget it.
Sometimes people can miss that kind of information. They might get confused a little bit. So you should put it in the front of the sentence in order to make sure that they never miss it.
Yes, you're right. And I think that we have finished with grammar too. And it's time to wrap the lesson up, right? What did we do at the lesson, Mr. Darrell?
Well, we looked at vocabulary at the very beginning, as you remember. That led us straight to the reading text, which was about pain assessment. And from there we moved on to the grammar, which was about cleft sentences.
Very useful text and very useful tips. Today's lesson. And what is the homework for today, Mr. Darrell?
Well, the homework, we'd like our audience to write a paragraph describing an ideal, healthy and good morning routine.
Okay, very good and useful. So to read and get some tips about healthy morning routine. And where can the homework be uploaded, Mr. Darrell?
Well, they can send it to the address that's on the screen right now. And there will be a sample write-up to follow as well.
Very, very useful, I think, right? So the only thing we have to do now is to say goodbye and look forward to the next lesson, Mr. Darrell, right?
Indeed, and
I think that we are going to change the topic at the next lesson.
We are going to, yeah, and hopefully we'll stay safe until our next meeting together.
Yes. Okay, so stay with us and keep on learning.
Until next time, goodbye.
Bye.